What is a BBL, Brazilian butt lift? Cosmetic life procedures have been the rave for the past few years, especially the BBL or Brazilian butt lift. However, despite its popularity, patients need to understand that all forms of surgical procedures come with some risks. This gives you all the more reason to know the dangers associated with a BBL surgery before you decide to go under the knife. What is a BBL? A BBL, or Brazilian butt lift, is a type of surgical enhancement procedure that is done in several steps. For the first step, the surgeon uses a cannula. This is a metal rod to suction fat from a certain part of the patient's body, typically the hips and abdomen. Small surgical incisions are made for plunging the metal rod in and out of the patient's body. The second step in a BBL is treatment and fat grafting. After treatment, small surgical incisions are made in the buttocks. Then the fat is grafted into the buttocks, adding shape and volume. This process of grafting is the same as the fat extraction procedure, in which a metal rod device gets plunged in and out of the area for fat distribution. BBL surgery cons. As stated earlier, there will always be risks to any surgical procedure. The following are the risks most commonly linked with Brazilian butt lift surgeries, although these may vary from one person to another. Blood clots, bruising, complications associated with anesthesia or liposuction, deep vein thrombosis, excess loss of blood, fat embolism with the injected fat moving to the bloodstream and traveling to the lungs, infection, necrosis of surrounding tissue or fat, pulmonary and cardiac complications, stretch marks. BBL is common and usually considered harmless. However, in reality, any form of cosmetic surgery also comes with complications and side effects. The most serious among the most common complications of BBL is fat embolism. There are reports of some patients dying after a BBL procedure because of fat embolisms. These patients died when fat clots got into their bloodstream and traveled to the heart and lung arteries. How to reduce risks of cosmetic surgery procedures. One of the best and easiest ways to reduce risks when seeking any type of surgical procedure, including BBL, is to always be your own best advocate. Make sure you do your research regarding the procedure first and understand its risks. You also need to talk to a board-certified plastic surgeon with sufficient experience in performing the specific type of surgery. During your BBL consultation, make sure you and your chosen surgeon work together to do the following. Collaborate and determine the best course of treatment according to all options available. Discuss any possible outcomes, risks, and concerns that you or your surgeon may have. Determine your reason for undergoing the surgery. Discuss your desired or anticipated outcome. Evaluate the current state of your health, including risk factors, surgeries, and pre-existing conditions. Review all medications you are using at the moment, or tobacco or alcohol used. Take photos of your body at different angles. Thanks for watching our video. For more information, please visit our blog www.stayathomemomco.com.